Good afternoon, everyone. This is Dr. Val Arkush. Welcome to our Wednesday press briefing for September the 9th. We are in the 27th week of the COVID pandemic in Montgomery County and our 11th week in the green phase. And today I'm happy to be here with my colleague, Commissioner Ken Lawrence. Since our September 9th press release, our September 8th press release, we have 52 new cases of COVID-19 reported in Montgomery County, which brings us to a total of 11,270. These positive cases are a result of a positive test for the virus, not from the antibody. All 52 of these cases are from the community, and happily, all 52 of these tests are from the last 7 days or less. So we have made a lot of progress on getting our tests back more quickly. These positive individuals are from 28 municipalities. All 62 Montgomery County municipalities are home to individuals with COVID-19. Today's individuals range in age from 10 years old to 84 years old. And as always, you can check our county map at moncopa.org/COVID-19 for updated geographic information. Today we have 30 females and 22 males. I'm also sorry to confirm that one additional Montgomery County resident has lost their life to COVID-19, which brings us to 829 deaths confirmed positive from COVID-19. This individual was 56 years old and died at a long-term care facility. Overall, 443 females and 386 males have lost their lives to COVID-19 in the county. They ranged in age from 36 years old to 104 years old. The racial breakdown, and this is self-reported as we have it, of the individuals who have succumbed to the virus, 18 Asian, 3 Asian Indian, 3 Asian Korean, 103 African American or Black, 326 white, and 376 unknown. In terms of our hospital beds, we're pretty much exactly where we were a week ago. We have approximately 48 individuals hospitalized in a Montgomery County hospital with COVID-19. 6 of those individuals are requiring a ventilator, or approximately 12.5%. All is quiet at the Montgomery County Correctional Facility today, with no new cases to report. The facility has now completed the 3rd round of testing for COVID-19. Testing was conducted on September the 3rd and 4th. Any inmate or staff member who has previously tested negative was retested. Test results were received over the weekend. All test results were negative. There were 655 inmates, 242 Montgomery County Correctional Facility staff, and 40 prime care staff. Prime care is the medical provider at the correctional facility. All of those individuals were tested for a total of 937 individuals. And again, all of these tests came back negative. Since the President Judge issued the initial March 12, 2020 order declaring a judicial emergency, the population in the correctional facility has gone from 1,342 to 837 today, a net decrease of 505, which is about 38%. Since March the 13th, there have been a total of 2,021 discharges from the correctional facility. I'm pleased to announce that testing continues to go smoothly in our 4th week with Mako Medical. With rare exceptions, our results are available within the contractually promised 36 hours. Our testing capacity is currently at 50 tests per site per day. This provides 300 tests per day across all of our county sites. But not all of these tests are being utilized each day. So I want to urge anyone who wants or needs to be tested to get tested. The more we are able to test our community, whether you have symptoms or not, the more we will know about what is happening across the county and be able to quickly suppress any outbreaks. The county has 6 COVID-19 testing sites open around the county. None of these tests require a car in order to be tested. These sites do require an appointment. All appointments are made on the day of testing beginning at 8:30 in the morning. You cannot book ahead. We do require that the person being tested is a resident of Montgomery County or works in Montgomery County. These county sites run at no cost, though insurance will be billed if you have it. They do not require a healthcare provider's order, and we will test individuals of any age who want or need to be tested. You do not have to have symptoms to be tested at one of our county sites. The cost of these sites is being covered by CARES Act funding that has been allocated directly to Montgomery County. I want to emphasize that you will not be billed or charged a copay for a COVID-19 test that is done at a county-run testing site. That is not necessarily true for other sites around the county. The sites are located at the following locations: in Pottstown at the Montgomery County Office of Public Health at 364 King Street in Pottstown, Lansdale 421 Main Street, in the Willow Grove area at the First Baptist Church of Crestmont, located at 1678 Fairview Avenue in Willow Grove, in Green Lane at Deep Creek and Snyder Road, in Ardmore at 114 West Lancaster Avenue, and in Norristown at 1401 DeKalb Street at the Delaware Valley Community Health Center. And each of these sites are open Monday through Friday. They each have rotating hours. So to see what the hours are and get more information or to register for a test, you can go online at montcopa.org/COVID-19 and click on the green County Testing Information button. And again, appointments open at 8:30 a.m. on the day of testing. You can also register by phone for all the sites. It's a single phone number. That number is 610-970-2937. And that also opens at 8:30 in the morning. There are Spanish-speaking operators on most days, and we also have language line available, so an individual can register for a test in any language in which they are most comfortable. Working together, we continue to suppress viral spread here in Montgomery County, but we are definitely seeing an uptick in cases. As you have seen from our data, we are now seeing 45 to 50 new cases every day, which means there's still plenty of virus circulating in our community. As schools begin to bring students back, keeping the virus suppressed is more important than ever. While many of our 22 school districts are beginning the school year with a virtual format, all are hoping that they will feel comfortable bringing at least some students back in person later this fall or in January. We also have many sports teams sitting on the sidelines because it may not be safe to play. The likelihood of our students being back in school and our athletes being back on the field is going to depend on all of us working together to keep the spread of virus in our county to a minimum. And folks, I have to tell you that right now we are moving in the wrong direction. So we really must take this seriously and redouble our efforts to suppress this virus. We are all in this together, and it will take every one of us doing our part to keep this virus at a lower place than it is today. So to take a quick look, here's our normal weekly graphs. We're going to start with our date of test graph. And as a reminder, the vertical gray bars represent the number of total daily positive tests, or the number of positive tests on the day indicated. And then the red and pink lines are the 7 and 14-day average. The dark blue and light blue lines are the community 7-day and 14-day average. And then way down there at the bottom are the long-term care facility 7-day and 14-day average. So you can see from looking at this graph that we hit our lowest point in terms of daily positives way back in the middle of June, right before we went into the green phase. And of course, that would obviously make sense. And I think we all expected a little bit of an uptick in our numbers as we went into the green phase. We did okay for a little while. We definitely had an uptick after 4th of July, but by the beginning of August, we were able to get that back down again. But steadily, since the beginning of August, our case numbers have been rising. And we'll take a look at the zoom in graph so you can see more clearly what's been happening over these last couple of weeks. And this is almost entirely from community spread. We have just a tiny handful of cases in our long-term care facilities. So this is us, folks. This is those of us that are going to work, that are out and about, that are maybe going to social events. We have to take responsibility for this, and we have to be careful. Now we'll show you our weekly positivity graph next. And just as a reminder, the jagged orange line represents the number of daily PCR tests being performed in the county. And then the blue line at the bottom is the positivity rate, or the number of tests that were positive on any given day. By every measure on the graphs that I just showed you, every single number is increased, both in our 7-day and 14-day rates. And this week, our positivity is up to 3.17%. I just want to remind you that we were below 3% for a number of weeks. And we are still below 5%, which is good. Below 5% is considered suppression of this virus. But this is a very worrisome trend. And I really hope that people will take this seriously and, again, redouble your efforts to stay safe in our communities. So I know you've heard this a million times, but I am going to say it again. Do not leave home without a mask. Put it on whenever you are within 6 feet of someone who is not in your household. I think the hardest thing for me is that I'm just going out for a run or a walk. It's so easy to walk out of the door without that neck gaiter or mask, something to cover my face. And I now, if I do forget, I make myself turn around and go back and get something, because I never know when I'm going to run into a neighbor who wants to chat for a couple of minutes. Just don't leave home without something to cover your face, even if you're just going for a walk in your neighborhood. When you do see someone or around friends or at any kind of social gathering, try to keep that 6 feet of distance from anyone who is not in your household. This is incredibly hard to do. As people, particularly in any kind of social setting, we naturally gravitate toward one another when we're having a conversation. But just get in the habit of taking a step back. We have to do this, because when we are closer than 6 feet for 15 minutes or longer, the risk of spread increases, even if we have a mask on. So it's important to do all of these things together. Keep your hands clean and away from your face. Get tested, even if you want to be tested. We want you to be tested. So get tested. We have the capacity, and the more people in the county that get tested, the more information that we have to keep everybody safe. And then if you do test positive, or you get called by a contact tracer because you've been exposed, please cooperate with them. These conversations are so important. They are confidential and they are non-judgmental. These conversations give all of us information on how and where spread is happening in the county so that we can make data-driven decisions. We have seen a big improvement in cooperation with contact tracers. And so what I mean by that is that of the people that we actually connect with, 97% of people are cooperating, which is fantastic. They're sharing the names of their contacts. They're committing to quarantine or isolate. So this is great. This is how we keep control of this thing. However, and this is our challenge, we're still having trouble reaching some individuals. Currently, we are connecting with about 60 to 70% of the people that we attempt to contact. So on average, about 65%. So that's 35% of the people that we need to talk to that are not calling us back. So if you receive a voicemail from one of our contact tracers, please call them back. It is so important that you do so. Making sure that we educate and support every positive individual is the best opportunity we have to keep this virus under control. When a positive individual or a direct contact of a positive individual receives a call from a contact tracer, here's what happens. First of all, you're officially informed that you're either positive and so you need to isolate, or that you need to quarantine because of a direct exposure. Contact tracers are able to answer any questions that an individual might have about COVID-19 or refer them for additional guidance. Contact tracers will ask if the individual is able to safely isolate or quarantine in their home. If they're not, no-cost alternatives are provided. Additional supports can be arranged, such as help with food delivery or other unmet needs. Contact tracers never, and I do want to emphasize this, never ask for social security numbers or credit card numbers or any kind of payment. So if someone says they're a contact tracer and they start asking you for that information, just hang up the phone. They're not legit. When you are called, your phone may show the name of any one of our community partners. Our community partners in contact tracing are ACLAMO, Visiting Nurses Association, or VNA, Family Services of Montgomery County, Montgomery County OIC, or sometimes it comes up as unknown. That can be a call from, believe it or not, us here at our Office of Public Health, or also Family Services of Montgomery County sometimes comes up as an unknown. When we get good contact tracing, we learn from that information, and we can let you know what type of activity are putting individuals at risk right here in Montgomery County. It's the best information that we can give you to take action and help keep yourself and your families safe. So a couple of announcements today. I mentioned this last week, but I just want to mention it again. The Your Way Home Emergency Rent and Utility Coalition is now up and running with a $6 million allocation from Montgomery County's CARES Act funding. Up to $9,000 of payments will be available to households that are at or below 100% of the area median income, are experiencing hardship because of COVID-19, and have overdue rent payments or overdue utility bills. These dollars can be used for either. As of yesterday, the county's Your Way Home program is working with the Pottstown Cluster of Religious Communities, ACLAMO, Manna on Main Street, and CADCOM to identify eligible households. If you want to find out if you're eligible, you can call any of those partner agencies, or you can call 211. It's that simple. Just dial 211 to learn more about the program. Keeping families in their homes, particularly now with so many students attending school virtually, is critical to the health and safety of Montgomery County households, and will help provide the necessary stability for families to get back on their feet as we work to recover from the impacts of COVID-19. So today I want to give a special thank you and shout out to our Montgomery County Office of Veterans Affairs. In August, they distributed backpacks and school supplies to over 250 active duty and veteran families. This was made possible by the Back to School Brigade, a program run by Operation Homefront. The items themselves were donated by Montco residents at various Dollar Tree stores in Morristown. So we want to thank everybody for that. Our Office of Veterans Affairs also resumed the Veteran Shuttle last month in August. Montgomery County provides a free round-trip shuttle service that will transport any veteran and one caretaker from their Montgomery County residence to a nearby Veterans Administration medical facility, including Philadelphia, Coatesville, Horsham, and Spring City. Additionally, they will also take you to the HealthLink Dental in Southampton, Pennsylvania. So our office is now using a large paratransit van because the minivans that we typically use don't work very well for social distancing. The paratransit van is quite large and it has 2 ventilation systems inside of it, which adds to the safety of the riders. They are running the shuttle 5 days a week until the end of the calendar year in order to catch up because many veterans could not get to their appointments while the shuttles were not running. To reserve a free ride, call 610-278-3285. That's 610-278-3285, preferably 2 weeks in advance of your doctor's appointment. And then finally, tomorrow, September 10th, is World Suicide Prevention Day. The Pennsylvania Department of Military and Veterans Affairs and our Montgomery County Office of Veterans Affairs is encouraging everyone to light a candle at 8 p.m. tomorrow evening, September 10th, in observance of World Suicide Prevention Day. U.S. military veterans are 1.5 times more likely to die by suicide than Americans who never served in the military. For female veterans, the risk factor is 2.2 times more likely. Montgomery County veterans can call the Monco Veteran 10-4 helpline at 610-213-4022 between the hours of 10 and 4 to get connected to help. Or the Veterans Crisis Line is available 24/7. That number is 800-273-8255. And there's also a 24/7 Veterans Crisis text chat, and that can be reached by texting 838-255. Again, you can text 838-255. And with that, I will announce that our next virtual briefing is Wednesday, September the 16th at 3 p.m. and happy to take any questions.
This afternoon, we're joined by Jim Melwork from KYW News Radio and Rachel Ravina from The Reporter. We'll start our questions with Jim.
I remembered to unmute today. You mentioned cases climbing and community spread. Is there anything in particular, any social gatherings, colleges, bars, restaurants, anything in particular that you're seeing in contact tracing for these, or is it true community spread when you say that?
It's primarily true community spread. So when it comes to our colleges and universities here in the county, we have had so far less than 10 cases in Montgomery County colleges and universities. Now, I do want to point out that Villanova and St. Joe's both straddle 2 different counties. In St. Joe's case, those cases go to Philadelphia's Office of Public Health. And in Villanova's case, they go to Delaware County. So we're not actually counting those cases here in Montco. But for the remainder of our institutions, which number around 20, we've seen less than 10. They all had very solid plans in place, and they really do seem to be following them. Our contact tracers have seen a few small outbreaks, mostly related to social gatherings, but we're not seeing one particular cluster, like large cluster in one particular place. We are really seeing this all over the county. And as you can see from just the number of municipalities today, I think there were 26 or 28. And it's like that every single day. So that's why I have to urge everyone who's listening to remember that any one of us can be completely without symptoms, but be carrying the virus and be contagious. So we all just have to heed these rules and these common sense guidelines to keep everybody safe.
Is it alarming that this is community spread? It seemed like for the past several weeks, couple months, that there'd been more of a, you could point to the social gathering or this, game or sports league, whatever, trips to the shore. Does it kind of concern you now that it's just kind of, I don't know if random's the right word?
It absolutely does concern me because we're not seeing a single large event. Like, for instance, in the early days, there were some employers that had large events, things like that, where we could go in and make an intervention and really try to mitigate. Obviously, we did that with our long-term care facilities. We all remember an extraordinary number of cases that we had in those facilities in the early days. And thanks to the interventions of our teams, our FAST teams, and a lot of hard work at those facilities, those cases are, zero many days. So this is a little more concerning because there's not a single thing to point to here. There is no single intervention that's going to really get these numbers down. Everybody has to do their part and just be extremely careful or avoid entirely social gatherings. That certainly makes it hard. It's just hard at social gatherings to keep that social distance, and particularly if there's any kind of food or drinking involved, people take off their masks. So we all just have to be mindful that this virus is all over the county. And if parents want their kids to get back to school or back onto the playing field, we have got to get these numbers down.
And on the flip side of that, is there just a baseline? I mean, the virus isn't going away anytime soon. Is there just a level of virus, and are we at that point?
I don't think we're at that point because we were consistently lower than this for a while. Pretty much through July. I mean, if you looked at that sort of July 4th spike, we pretty quickly got back down into the high 30s, low 40s each day. And I would really like to see our positivity back under 3%. I think that that's a sign that we really do have very substantial viral suppression. What we're seeing right now is just 1 week to the next, a steady increase in the number of cases. And it's just been consistently going up for the last several weeks. We absolutely can do better than this.
And last question, I've asked this a few times. Is it time to move testing out of the diagnostic realm to get away from PCR testing and more into a surveillance mindset with the cheaper, less sensitive, for lack of a better way to say it, but the rapid test that can be done at home?
I just don't think we have the right test yet. It would be great if we did, but there's nothing approved to do at home that doesn't. I mean, there's some there are one or two saliva tests that I think you can, sort of put saliva on a card at home, but it still has to be mailed. It's still a PCR test. So it'd be great if we have those tests. I have been calling for a national strategy around testing since a couple weeks into this pandemic. And I spoke months ago about the need for an accurate, cheap, rapid test that could be done at home or at a school or at a workplace. But we just don't have it yet. Nothing is cheap enough and nothing is sensitive enough to really be particularly useful in schools or workplaces. Now, some places are using these tests, and that's fine. And if they can do it frequently enough, then the lack of sensitivity can be somewhat compensated for by doing the tests frequently. So if people are able to get the tests in a high enough number and they can afford them, there's nothing wrong with that strategy. But I do want to point out that at our own county testing sites, we're urging people to come and be tested, whether they have symptoms or not. So we've been doing surveillance testing at our county testing sites for months, and we want people to come. We don't care if you have symptoms or not. The more people that get tested, the more information that we have. And, so please come. But I do hope, as we all, as every school principal and every large employer does, that we will, at some point in the relatively near future, get a inexpensive and fairly sensitive 15, 20-minute test that people could do at home before they leave for school or before they leave for the workplace. That would be ideal, but we just don't have it yet.
Thanks.
Thanks, Jim. Next, we'll go to Rachel Ravina.
Hello, good afternoon. I just wanted to start with respect to the uptick in cases. Was there any contribution or any affiliation with the long weekend that we just experienced over the holiday?
It's too soon to know that. If you think about how long it takes for people to test positive, it's on average between 5 and 7 days after exposure. So we really wouldn't expect to start to see that uptick until, maybe the end of this week, but more likely early next week.
Absolutely. Thank you for clarifying. And with respect to the Montgomery County Correctional Facility's third round of testing, what does it mean on this third go around to have completely negative tests across the nearly thousands of people that were tested?
Well, I think it means two things. One is that our team there has been working incredibly hard, as they have been from the beginning of this pandemic, to keep every inmate safe. And after we had that small outbreak that began in the early part of August, we sort of completely re-examined all the procedures, all the ways that people were traveling through the facility. We had someone from our Office of Public Health and Department of Public Safety go out, just a fresh pair of eyes, to take another look at the facility. They've reviewed all the safety protocols, and everyone's just being extremely, extremely careful. We hope that everyone is truly negative. We do have to acknowledge, and I reminded the staff of this when all these results came back negative, that even with the nasal swab PCR test, there are some false negatives. It's a pretty small percentage, probably no more than 5 or 6%. So it's possible that there are some false negatives in the group. So they aren't relaxing anything that they're doing. They're continuing to be as careful and stringent in their movements and their cleaning and all of that as they have been. But it's certainly great news that nobody's test came back positive.
Of course. And is that going to continue on a case-by-case basis, or will there be another round of testing in the works?
We haven't made that decision yet. We test every inmate who displays any symptoms or has any kind of fever. So that's been happening routinely. We test every single new commit into the correctional facility. And in fact, they go through 2 levels of quarantine. Any new commit into the correctional facility, even if they test negative, they're quarantined before they are let into the more general, what we call the general population, which are the individuals that have been there for some period of time. And we will not hesitate to do a 4th round of testing if we have any concern that there is another outbreak in the general population. We have been seeing in the new commits a fairly high positivity rate. Some weeks it has been as high as 15, 17%. Other weeks it's been more like 6, 7, 8%. So we do have positive individuals coming into the facility with regularity. But it was what triggered this last round of testing was the fact that there was an outbreak in the general population. So if we see anything like that again, we will absolutely do a 4th round of testing.
Thank you. That's all I have.
Thank you. We have no further questions today.
All right. Well, thank you, everybody. Please be safe out there. Keep that mask close at hand, and we will see you next Wednesday. Be safe.